One of the things that I wish women knew about the fact that healthcare apps are on the rise, focusing women's health, is that yes, it's great that menopause and endometriosis, pregnancy loss, heavy periods, etc. are beginning to get some press, but the changes that are happening don't appear to be happening in the main healthcare systems or within workplaces that could actually support women. They're happening through tech, women's health apps, and in many ways the information that you're providing, they're not telling you which part of it's medical, which part of it's wellness. So there are a lot of people, health app developers for example, whose background isn't medical, but they're accessing your medical records. And on top of that, you then don't know what they're doing with your data. So I can tell you now what they're doing, finding ways to sell you something else. So now that we're seeing this huge rise in women's health support, it annoys me that women's health is actually being used as a commodity, a way of making money, rather than really getting to the issue, which is that workplaces need to improve their policies for women. Women's access to healthcare in the mainstream needs to improve. For that reason, I've set up SheRanked, which is a platform where I've gone on as a doctor and I have reviewed as many healthcare apps for women as I can find. If you can't find your favourite, drop it in the comments. And it's not because these apps are bad. In actual fact, some of them have some very good medical writers. Some of them are more transparent and helpful than others. But there are a lot of people making a lot of money off your medical information. And for that reason, I will be fighting to make sure that those apps start reaching a gold standard and women start getting the help that they actually need. Can't find your app? Drop it in the comments. Hope it helps.